Hi, my name is Sean Knierim. I graduated in 2008 from Duke with a degree in international development policy. Right now it's mid-July of 2020 and I get to live here outside of Los Angeles. Since my time at Sanford, I've had the opportunity to work across a number of policy challenges, both for the MacArthur Foundation, the Jeff Skoll Group, and now for a number of organizations that we've created in the last 5 years. The work I've done has ranged from international work on human rights, biodiversity, climate change, domestic work on education, immigration reform, and some other stuff. For the last 5 years, I've been a partner at a consulting firm called Side Porch that I helped to found, and also a partner at an investment group called Estabrook Investors. The public policy challenges that are very much on my mind right now, and I'm sure on the mind of many others out in our community, is the response to COVID and this pandemic that is affecting all members of all the communities that we care about. This challenge and the reason why Sanford was really and Duke was really helpful for me in understanding how to work across it. This is a complex, interconnected challenge that touches all systems. And right now we're having to figure out how to create context in new ways in individual settings and for our own organizations, plus how those new ways of building context are actually moving in and across the different communities that are coming in contact with each other. So this is something that for us, we're thinking about how to provide appropriate resources for all communities. And we're thinking about framing this in terms of, first, a culture of health. What do organizations and groups of organizations position themselves as in terms of what they're going to be held accountable for and what they are going to hold members of their communities responsible for. And another approach that we think is really important right now from a policy perspective is starting one's framing on figuring out how are you going to serve the most vulnerable in the communities that you're tasked with serving. And we find that if you start with the most vulnerable communities in terms of policy development and execution, likely you're going to find ways that you serve all the communities that you get to touch and serve. How is from my time at Duke, how is it influential right now? I think there's a whole bunch of different ways of things I've learned in the classroom, but also even more importantly from the colleagues I had, both on the professors, the staff, and the other students. Stakeholder analyses are essential. Working on challenges like COVID, understanding how different communities and different groups have different problems and have different perspectives is essential, and then figuring out how to knit those together, which is something that I learned from many of my colleagues that I still keep in touch with today, a decade on. Also, something that was shared with us really at the very beginning at Duke, and something that's always been true, at least in my experience, is that it takes all sectors in order to accomplish any type of significant change. Can't just be government or just the private sector or the public sector or NGOs. It takes all of these working together, and these differently incentivized groups that have different perspectives, it's challenging to bring them together. And that's the work to go about doing that, and the tools that I learned, and perspectives and experiences and wisdom I learned at Duke is something that we're trying to put in play right now. My name is Sean Knierim, and this is why public policy matters.